Chapter 1, Introduction to Community Paramedicine. Community paramedicine is a newer concept of pre-hospital care, and it's designed to fill the gap between access to primary care services and the needs of the community. So the goal is not to encroach upon services that are already being provided, but rather fill the voids and help to make the transition and the continuity of care of a patient through the system easier. The role of a community paramedic does differ from a traditional 911 paramedic, where the community paramedic's focus is working in the patient's home, preventing conditions before they're allowed to escalate to life threatening emergencies that do require a 911 activation or a lengthy hospital stay. A couple similarities that we can take note of: a community paramedic is an extension of a physician in the field who operates under medical control the same way that a field paramedic does. A difference in that is your community paramedic is more so an extension of a primary care physician, as opposed to a 911 medic being an extension of an emergency department physician. Community paramedics also interact with the local community and participate in public health initiatives like vaccination programs, stop the bleed training, CPR training, and numerous other ones. And the role varies from jurisdiction to jurisdiction, as a community paramedic's role and really even a 911 services role is based off the needs of the communities that we serve. A community paramedic visit really varies on local protocols and needs of the community in terms of what that visit looks like. But a common community paramedic visit includes a home safety assessment, chronic disease monitoring and management in accordance with that patient's plan of care from their physician, medication inventory and compliance, a wellness check. A community paramedicine program is based on an expanded role of a paramedic that really starts from the National Highway Traffic and Safety Administration's standard curriculum for paramedics, and then through specialized education and training such as this, you can meet the local requirements needed to become a community paramedic. In some places, they do require up to 2 years of experience as a paramedic, in addition to completion of a community paramedic program to be certified or licensed in that state. Minnesota is one of the first states to require or have a licensing program for community paramedics. The scope of practice for a community paramedic isn't different than a traditional 911 paramedic, but it just expands that definition to when, where, and how a community paramedic can provide those services to patients. Another key concept of any community paramedic program is a reliance on a local community needs assessment. This is done annually by the state's public health department and emergency managers to identify any of those community needs. A good example is if this community needs assessment identifies an increase in the diagnosis of diabetes within this community, then a community paramedic program can fill those gaps by visiting patients in their home, doing an assessment, and identifying any risk factors for diabetes, such as nutrition, compliance with medications, etc., and thus influence public health initiatives by filling that gap as a community paramedic. The history of community paramedicine, it really got its start in 1995 with the Red River Project. This project was one of the first pilot programs. It's where the term community paramedic and community paramedicine come from. And what they found was there was a need for access to primary care services. There wasn't a lot of primary care physicians in this area in New Mexico. And this community paramedic program was able to fill that gap. Now, ultimately, the program did end as a result of increased primary care access in that region. So there's no longer a gap to fill. But from this Red River project, we started seeing more and more programs. If we take a look in 2006, the Nova Scotia program and the model that they used, where they incorporated the community paramedic into the system with nurse practitioners, and in most instances were able to triage, treat, and release patients in the home setting before even having to access any sort of advanced care such as 911 or a hospital stay. Since the Red River Project, community paramedics have been expanding throughout the country and even the world. In 2015, more than 33 states had a community paramedicine or mobile integrated health program in their state. The term mobile integrated health is different than a community paramedic or community paramedicine. Mobile integrated health is the services utilizing all of the allied health professionals, including community paramedics. So think of mobile integrated health as multiple different providers in an integrated unit to influence public health, whereas a community paramedic is an individual component of mobile integrated health. Community paramedicine is still in the early stages of development, implementation, and integration. We're seeing more and more programs pop up throughout the United States, and funding is an essential component of those programs being established and being able to sustain themselves and grow and evolve within this healthcare system. Funding models vary and look different depending on where you go. You may see models where the hospital reimburses the agency for services. You may have models where they're funded off of grant money or charging patients fees for services provided in the home. There's also increasing support from physicians and other stakeholders within community paramedicine and mobile integrated health for community paramedic programs to be able to bill a patient's insurance, such as Medicaid or Medicare, which is really beneficial in terms of the sustainment of these programs if we're able to get to that point in the near future. As discussed, community paramedics play a critical role in our U.S. healthcare system. We fill gaps in the delivery of healthcare services, and we help meet the unique needs of each community that we serve because each community has different needs, and that's our goal is to identify that need and fill that gap. The International Roundtable on Community Paramedicine defined the role and scope of a paramedic. This may look different depending on which part of the globe you're on, but in general, the roundtable has differentiated the scope of practice into two terms. Expanded scope, which is where you have received that additional training and specialized education as a part of your initial program, and expanded role, which is where you've received additional training and education outside of your initial program to meet the scope of practice. The expanded role model is the most common, and the scope of practice for a community paramedic is the same as a field paramedic. Just your community paramedic has additional training and education and competency in community health to meet the needs of the community. Being qualified as a community paramedic, the North Central EMSS Institute created the first curriculum for community paramedics, and since then has been updating and evolving that curriculum as the field changes and evolves. So new training programs and community paramedicine programs are based off of this initial and developed curriculum. The scope of a community paramedic falls under your national standard curriculum. Community paramedics do not practice individually, rather under the direction of medical control and a patient's primary care physician. The primary care physician may also act as the medical director and may be truly involved in all facets of that program and is a critical link in the access to primary care services. The primary care physician is responsible for providing that patient's plan of care. The plan of care from that physician is really what helps direct us during our visits in terms of how to monitor and manage our patients during those home visits. The role of a community paramedic is bringing primary care to that patient's home. We can help reinforce information and instructions from the patient's primary care physician. During the home visit, we can serve as the eyes and ears of that patient's physician and help to identify any issues, and even in some cases, speak directly with the medical director or the primary care physician during the home visit. We may serve as a translator for patients where we assist in translating medical terminology or directions from the primary care physician that patient may not completely understand and be too embarrassed to ask the doctor about. They may feel more comfortable asking us in their home. We can explain steps and report all of these findings back to that patient's primary care physician, who can then adjust that patient's plan of care as necessary. Community paramedics also serve as a navigator for our patients. We should be patient advocates here and help refer patients to different types of services available within the community that can benefit them. So, part of being a community paramedic is being very familiar with the different outreach services within your local jurisdictions. Part of being a community paramedic is building bridges and creating partnerships and professional working relationships within the existing healthcare structure. This requires you to be a good team member and be able to integrate yourself into multiple different facets of healthcare effectively to expand community paramedicine. The different types of team members that you may work with as a community paramedic include medical directors, physicians, primary care physicians, EMS systems, nurses, social workers, and even care managers. The medical director serves multiple different roles. They serve as a liaison to different healthcare organizations who may be requesting community paramedic services. They are an educator, a supervisor, a resource for community paramedics during home visits, training and education, an evaluator of the services that we provide, and in many cases, a conduit through which the information gathered is funneled to the patient's primary care physician. The physician plays a vital role in a community paramedicine program. This determines how the community paramedic will monitor and manage a patient during a home visit. The physician also has to believe in the program itself. And part of the community paramedic's job is to make that physician believe. This is done through our behavior, our attitudes, how we carry ourselves, how we incorporate in the healthcare team, and also how we report information, right? We should report information clear and concise to different levels of healthcare as we integrate ourselves as a multi role provider in the system. EMS systems. Community paramedicine should have a link to an existing EMS system. This may be as a part of the EMS system itself. So if the scene transitions into an emergency, you can take over care from there. Or it may be being able to activate 911 from the patient's home visit, and then provide a full patient history and allow that continuity of care to take over into the hospital. Nurses also play a critical role, and it's absolutely essential for a community paramedic to be able to communicate and have a good working relationship with different types of home health nurses that you may encounter. Because, like we said, the goal of a community paramedic program is not to encroach upon services that are already being completed, rather fill gaps. Healthcare agencies and community paramedic programs work very close together and share information and share referrals as they identify different gaps that they may not be able to fulfill at that given time. We also interact with social workers. Social workers help to connect patients to community paramedic services. They may serve as a member of the healthcare team. So, taking a patient with extensive behavioral health challenges, the social worker may be assigned to help that patient with daily activities, and as a resource, that information will flow through the community paramedic during additional visits and gaps that have been identified. The social worker is also someone who's very knowledgeable of local resources that could benefit the patients. As the care of that patient starts to encompass a wider scope, oftentimes they're assigned a case manager to help contain healthcare costs and coordinate appropriate care for that patient or group of patients. A case manager may be the person responsible for referring someone to a community paramedic program. That may also act as a conduit for information from primary care physicians to paramedics, so that may be a point of contact for you as a community paramedic. And they're also someone who helps to connect patients to appropriate services. The key to an effective community paramedic program is fostering and establishing effective working relationships with all of the community stakeholders. The goal of the community paramedic program has to be to go out, find gaps and needs within the community, foster those relationships between organizations as we fill that gap, and develop strategies to meet those identified needs. As we accomplish those things and build those relationships with stakeholders, the community paramedicine program is really able to incorporate into mobile integrated healthcare and be a functioning member of that team, enhancing patient care outcomes.